Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi guys, welcome back. I hope that you're enjoying all these episodes that we're doing on ADHD because I think it's such a complex topic. Today we're going to talk to Dr. Megan Loeb, who is returning to talk to us about medication and its role in supporting kids and adults with ADHD. We're going to talk with her. As you know, she's a pediatrician and she has been in practice for over 19 years. And she's going to offer us some thoughts that she has and uses with her own patients on how to decide if medication is a good next step in your toolbox for ADHD. With that, let's get to Megan.
Oh, I'm so glad to be back. Thank you.
Yeah, absolutely. Okay, so let's jump in and kind of talk about when, as a physician, when you're looking at ADHD, what is that? How do you define what that is?
Yeah. So put simply, ADHD is a neurodevelopmental disorder characterized by deficits in what's called executive functioning. And so when we think about executive functioning, that's a big blanket term, right? And I think it's that way on purpose because we can say, hey, what does that mean? And it is, hey, I am an individual that has difficulties with attention, with focus, with impulsivity, with my emotions too. And that is there at such a level that it affects my functioning in the world that I live in. And it affects the other people around me too. So that's kind of when I talk to families about what is ADHD, is what we say kind of as a first pass.
Yeah, that's a great definition. So it's so broad and it's just like you said, on purpose, because every person with ADHD is their own unique person.
Absolutely. And, another thing that I'll talk about often is once you know one person with ADHD, you know one person with ADHD because it is so different in how it presents from individual to individual. But at the end of the day, what it comes under is executive functioning is really, really hard.
Yeah. And we're looking for it to be pervasive. Like it's not just one setting that it's happening in, right? Like we're looking for it to happen generally.
Yeah. Yeah. And that's a great thing to bring up because that is part of when we look at diagnostic criteria for what is ADHD, it is, hey, this is present in 2 or more areas of your life. Now, I'm a pediatrician, so I see kids. So those 2 areas are typically home and school, but in adults, it might be work, right? So you're seeing those struggles in 2 or more environments that you're in. When I think about ADHD, it is what we would more call a clinical diagnosis. So it's something that I make with my patients over time, but at the same time, there are criteria that need to be met to really consider that diagnosis. And that falls under the DSM criteria. You could probably talk more about that than I could. But there are certain traits that are inherent and part of what is ADHD that we review with families and their children, but also is something that families will fill out in paperwork objectively, both them and that other environment, school, right? Yeah. So it is the things that I mentioned, but also that it's causing problems in those areas of life.
Yeah, totally. And I won't bore people with going over the DSM criteria, but I will include it in our show notes because those are, I mean, parents sometimes want to know, but it's not super interesting to talk about verbally because you have
And
way
it's
more important things to talk about.
really, really long. And frankly, I wouldn't be able to recite them all to you.
Yeah, it's fair. I like to double check myself.
Mhm.
Okay, so talk a little bit about what is the difference between an ADHD brain and kind of how it functions, and then a neurotypical brain. Like, what are we noticing? What is medicine saying about what we're thinking is happening in this area?
Yeah. Okay. So I'm going to use some medical words here. And so if I need to define things, let me know. But
Yes.
what we have learned over time is that some individuals with ADHD have differences in how their brain transmits information and communicates to different areas of the brain. And what we see is that in a certain area of the brain, it's called the prefrontal cortex, that, for lack of better words, just isn't working like we would anticipate it to. And that with that, some levels of things in the brain, we call them neurotransmitters, are not where we would expect them to be in a person that is neurotypical. And those neurotransmitters, which probably most people have heard of before, are called dopamine and norepinephrine. And dopamine is a neurotransmitter that we kind of think of as like the feel good and also the making decisions and paying attention neurotransmitter.
Hmm.
And what we're noticing and seeing is that in a lot of individuals with ADHD, that's not the same as it is in a neurotypical person.
Yeah. So you talked about the prefrontal cortex, which I think is an important part of the brain. I mean, we need it. So it's the front part of our brain, and it helps us to like make decisions and process through things. And unfortunately, it's also the last thing to develop, right? Because our brain is kind of developing from the bottom under our skull and then kind of goes in a rainbow forward. And that's, because we need things back before that, more importantly than we do the front part of the brain, but we need all of it. So that
Survival is more important than decision making, right?
exactly. Yes,
Yes.
yes. And we've got parents to help us with decision making. So we really
Yes.
lean on them on that part. But the prefrontal cortex, that's where it's at. And then when you're talking about these neurotransmitters, they're kind of like how things run, right? Like it's kind of like the wiring in our brain, just to break that part down. So I think it's important to know that we're thinking that people with ADHD can be deficit in some of these areas or not have as much dopamine, like
Yeah.
naturally occurring, or norepinephrine. And like we want that, those are good feelings.
Yes. Absolutely. I mean, you said it, girl.
Yeah, so that's great. So then I guess that kind of leads us into this part about like, okay, so now we know there's a chemical part. So it's not just behavioral, because I think a lot of times ADHD gets labeled as this like behavioral thing, or they're doing it on purpose. But this, we're thinking really this is a chemical thing, which is why this conversation around medication can be so important, because it's not
Mm,
just about changing the behaviors. It's also recognizing that there's something so different in their brain that can kind of get in the way.
yes. Yes, 100%. And I think it is a step of learning that this isn't behavior. This is my brain is wired differently. I see emotions differently. I respond to things differently.
Hmm.
That's not an excuse. It is a fact.
Hmm.
And in order to provide appropriate treatment for people with ADHD, you and I both know that's a multifactorial thing. It's not just one thing,
Absolutely.
but medication can be really helpful in saying, hey, our thoughts are that the medications will increase dopamine and norepinephrine in the brain to assist with those emotions,
Hmm.
to assist with that inattention and hyperactivity and also that impulsivity. Is it going to make everything go away? No,
No.
because this is a part of your brain structure.
Mm-hmm.
And I think I want to just pop in the midst of that because I feel like a lot of what we're saying right now are negatives about ADHD.
Mm-hmm.
My patients with ADHD are some of my very favorite people in the entire world. They see the world differently, right?
Mm-hmm.
They are folks that are so creative and so ingenuitive that there's parts of this brain that are amazing, but it's also hard.
Mm-hmm.
And our goal in the treatment of ADHD is for that person to be that person, but to be able to focus in a little bit more
Yeah.
and to work on that impulsivity as their brain is growing and developing.
Yeah. Well, and I excuse me, oftentimes parents will say to me, like, I don't want to do medication because I don't want my kid to be somebody different than who they are. I don't want them to be changed, right?
Mm-hmm.
And I don't know about you, but I don't find that that's what's happening as how we're treating ADHD now. Maybe that's what it happened years ago, maybe when we were over medicated,
Yeah.
right? Or we didn't have the right type of medication for different kiddos and
Yes.
adults, right? We have such variety now, but I mean, what do you think on that?
Yeah. I know that we've been treating kids with ADHD with medication for decades, right? And
Hmm.
I will get that question a lot, or even that statement. I know my kid has ADHD, but I am not giving them medication. And for me, I want to engage my families in a conversation and know where that belief system came from and kind of walk through it together as we are doing shared decision making about their child, my patient. And a lot of times it is like people from my generation. I'm Generation X, right? Like we remember kids in the back of the classroom who, for lack of better words, were zombies or who were not participating. And it was like, oh, that's the kid with ADHD. They're gorked out on their medicine, right? And I will tell you, probably 7 or 8 times out of 10, that is that we've had experiences in our past that are negative. And I tell my families with their kids that if that is the direction that we're going with treating your child, then I am not doing my job well because that is not where we're at now. We are saying, you come to me and say, I love my child and who they are, and I love their creativity. And I say, me too. And I say, you know what? Look at me, my middle-aged self. I am sitting before you without my glasses on and I cannot see what's going on in this room around me very well, right? Like I can
Mhm.
communicate, I can participate, but I am not at my best. And then I put my dang readers on and I can see the screen and I can see what's in front of me and I can do my job even better. And that in my world is exactly what medication can do for the treatment of ADHD. Is that an all the time thing? No. Is anything an all the time thing? No. But that's
Yeah.
what it can do. It can give our kids the ability and the adults too to just slow down so they can see the world around them.
That's a
And
great
yeah,
analogy. I
yeah.
love that. Yeah. Because yeah, our belief system sometimes gets in the way of how we handle things, even not outside of ADHD, just generally as a parent, what we think is happening. And so it's
Mm-hmm.
good for us to like slow down, hear what the options are, hear where we are in medicine now and what benefit different things can have for our kids. So let's talk about, so obviously we talked about meds, but like what do you think are the other options that parents have to support their kids with ADHD?
Yeah. I think it's really important to walk through those things. And I also say it's not a one time walkthrough. As a parent, when your child is diagnosed with ADHD, the first thing that we do is say, my kid has ADHD. Okay, but my kid is still my kid. And I love my kid. But at the same time, my kid's brain works differently. So maybe the things that I wanted them to be amazing at, or the things I saw them doing, are not the things that they're going to do. They may move another direction that is completely just as awesome, but it's just saying, okay, I am seeing my kid through the lens that this is part of who they are now, and that's okay.
Yeah.
So when I talk about treatment, we walk through things that are helpful from the terms of ADHD treatment. And the first thing is what's called parent behavioral training. And a lot of parents will ask me, they'll say, well, do I need to get my kid into therapy right away? And the answer to that would be yes or no. It kind of depends on the kid, just like everything else, right? Like, there are times when I would say yes to that, but there are always times that I'll say, you as a parent need to learn about what ADHD is, and also learn what parenting is involved with ADHD, because it's not the same as parenting a neurotypical kiddo. And it's also not a one size fits all, but there are so many resources out there when it comes to arming ourselves as parents to be able to better understand and to respond to our children. And that can be things like parent support groups. Definitely, like in Kansas City, our local CHAD chapter is pretty active, and I know has regular meetings for families, and also for teenagers with ADHD, and that can be a resource. I know that different psychologists and counselors may have parent support groups where they walk through, hey, things as simple as what is ADHD, to what do I do from a school environment, to how do I parent this kiddo, right? All of those things being covered. Like I said, there are a lot of written resources. There are really good books out there about ADHD. But there are also, like here, other podcasts that talk about ADHD, websites that do. And I always tell my families that you're not going to be able to digest all of this quickly. It's going to be over the next, 12, 15 years, and things will change as the mental health community learns more about ADHD. But our job as parents is just to be the parent. Right. So that's the first thing, is what we call parent behavioral training.
Which is almost like putting your own glasses on as a parent. Like it's like that is right. So it's like the kid could potentially get their glasses, right? But then also the parent needs their glasses too. I love that way that you're presenting that information.
I love how you expanded that analogy. That was so good. The second thing is school. And in a big blanket term, that would be school accommodations. And we could go into this for a very long time, but this is not that episode. Maybe we can do another one, right? Yes. Where we talk about what exactly that means, but that's going to be different for each kid too. And that's going to be working with your school administrators and teachers and counselors to either communicate the diagnosis, and I would say always communicate the diagnosis, but if that diagnosis of ADHD is causing difficulty in the school environment, then taking that a step further in creating a document, which is called a 504 plan, to account for accommodations in the classroom, which ultimately helps your kid and it helps the teacher too. So those are really the things that come under the blanket of, hey, what's evidence-based in the treatment of ADHD? along with medication. There are a lot of other things out there that go under the blanket of treatment of ADHD. And some of those things can be really helpful, like making dietary changes, like working with an occupational therapist, like working with an ADHD coach, like thinking about the regular things in life, like having good routines, getting good sleep. All of those things are going to be helpful. So good things to think about as you're walking through life with your ADHD kiddo.
Yeah, that's all really good advice because it's every kid is so different, right? Just like we've said,
Every kid is so different. Yeah.
So let's move on to medication or go back to medication. So when do you think medication is important to talk about with families? So maybe they've had a diagnosis or when on that line. And when do parents need to consider thinking about medication for their child? So like when do you bring it up and when should parents be considering it?
Yeah, I always bring it up at the beginning because to me, it's part of the treatment regimen, right?
Mm-hmm.
But then the family, the parents, they decide, I guide when that is important and appropriate for their child. I had a good friend once say ADHD is not a problem until it's a problem. And then when it's a problem, that's when we consider medication. So you can take that focus and that's appropriate. You can also take the focus of, man, this inattention, this hyperactivity, this impulsivity, all of these things, man, we may be functioning right now, but we're not thriving. And maybe now is time to. So it is a very much an individual thing. And there's so much involved in that, right? I mean, we've already gone through a lot of that. There's so many like little biases or this and that I want my families to feel comfortable. And I want them to feel like they are really at the helm of this ship of helping to make decisions for their children. So sometimes we walk beyond the point where I might think medication should have been started, but I'm here to guide and we can always backtrack together. And ultimately, what I always talk to my families is they know their kids best. And we're going to continue talking. This is going to continue evolving. As you're learning about ADHD, you may go, oh, hey, I think this is time now. I've read, I've learned, I've studied, it's time. And I say, okay, it's time.
Yeah, that's great. So let's talk about how the medications work. So I know, there's obviously some different categories, but to make it into two general categories, we have stimulant and then non-stimulant. But like, how do they actually work in the brain? Obviously, let's not get too specific, right? But like a general way.
Remember those neurotransmitters we were talking about? We really think they increase the neurotransmitters in their brains. So in our stimulant medications, that's both dopamine and norepinephrine. In our non-stimulant medications, that's not dopamine. It's just norepinephrine. So while both of those class of medications can have a role in the treatment of ADHD, and that is again, individual dependent for so many different reasons. When we look at efficacy, so efficacy is how well something works, right? Like the stimulants work better the majority of the time.
Yeah. With the issues that we're trying to address. And obviously every family and kid is different. And sometimes we have side effects and those are not tolerable. And so we have to work with our medical team. But in general, we're seeing, I agree. In my practice,
Exactly. And it just goes back again, like you said, completely individual.
Yeah. Okay. So what do you want parents to take away from this? We've downloaded a lot of information about why medications can be so important in this toolkit that we're putting together for ADHD kid. But what do you want them to take away from this conversation?
Love your kid. Get to know your kid. Get to know ADHD, what it is, what it isn't, and read and talk to your kid's doctor, make decisions together, and recognize that starting medication for your child to treat a neurodevelopmental disorder can be a really good thing.
Yeah. And something on that I want to say that we didn't say earlier is like sometimes when you try the stimulant medication, if it doesn't work, you could stop it. It's not something, it goes in and out of your system pretty quickly.
Oh, exactly. And, again, that is what I say all the time. I say, okay, let's do a medication trial. That's exactly what it is. It's a trial. Mm-hmm. And we start that trial together and we walk through that together. And a lot of times we choose the correct medication and it is something that is helpful for my patient. But sometimes we have to trial lots of different medications before we find something that is appropriate for that kid. So it's a journey. And I think that would be part of what I would say as what I would want people to know as well, too, is it's a journey. It's not any sort of a quick fix. It is we're working together just to help your kid.
Yeah, I love that. Yeah. Well, thank you so much for your time. This has been so insightful. I just love hearing your thought process and how you're helping support your patients with ADHD.
Oh, thanks, Bryce. It was great talking to you, too.
Yeah. Come back soon, right?
Right. You got it, girl.
Thank you so much, Megan, for helping us break down this idea of adding medication to our toolbox with ADHD. So I think as we're summarizing this, I think the things I would like you to take away are ADHD is not behavioral. It is really a difference in how our brain is working. And so medication can be helpful in that, and that medication is just a tool, right? Just like she said, her glasses are a tool for her, medication can be a tool. And that finally, medication is a decision to be made with your team of important people. So parents, child, and the prescriber. So whether that's your pediatrician or a psychiatrist, that decision is to be made in the entirety. And also if you have a therapist, with them too. So I think taking those pieces into consideration, that you need to do what is best for your child, regardless of what other people are saying. So if your thought is we're not ready for medication, then honor that. And if your thought is we are ready for medication, honor that. So with that, have a fantastic day. If you like what we're doing, please subscribe and rate us, and also follow us on Instagram and Facebook. Send us an email if you have any suggestions for shows at accidentalexperts@gmail.com, and we will look forward to seeing you next week. Have a fantastic day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.